Organic effects of radiation are those that can be observed at the macroscopic level. These have been observed in insects, animals, and human beings, atomic bomb and nuclear reactor victims. At this level, we can talk about early and late somatic effects. As we said before, organic effects of radiation can be divided between early somatic effects and late somatic effects. Early somatic effects are seen early on following exposure to radiation and are the result of acute high-dose radiation exposure. One or more of the early effects outlined may appear following radiation therapy treatments. However, the area of the body exposed is small compared to whole body exposures. Consequently, the effects are localized. Some examples of early somatic effects are nausea, fatigue, skin reddening, epilation, and desquamation. When a large dose is delivered to the whole body, the early effects are more severe and may occur in succession. The manifestation of these effects is called acute radiation syndrome. What are the 4 stages of acute radiation syndrome? Prodromal stage occurs within hours after whole body exposure. Then comes the latent period, which is about 1 week, during which no signs occur. Towards the end of the first week, signs begin to develop, and this is the manifestation of the illness. Signs and symptoms involving the hemopoietic, GI, and cerebrovascular system become visible, followed by either recovery or death. The 3 classic ARS syndromes are the following. Hematopoietic syndrome occurs at 1 to 8 sieverts and is characterized by the following clinical signs and symptoms: nausea, vomiting, and diarrhea. Due to the relative radiosensitivity of cells in the body, the blood forming organs are primarily affected. Above 1 gray, chances of survival diminish with increasing dose. Recovery may occur in weeks or months. Gastrointestinal syndrome often follows absorbed doses of 6 to 10 grays. In fact, at doses from 6 gray to 10 gray, in addition to blood forming organ effects, the digestive system is also affected. Death occurs in days as the epithelial cells are destroyed, causing bleeding, infection, and dehydration. In general, the cerebrovascular or central nervous system symptoms only occur at doses of 50 gray or more. Death will occur within hours or days due to cardiovascular collapse and neurological impairment. Given the extent of radiation dose, the victim does not have time to exhibit hematopoietic or gastrointestinal effects. Late somatic effects are the result of either whole body or partial body doses of radiation received acutely or over a long period. They manifest themselves months or years later. There are 2 major types of late somatic effects. Stochastic effects are those that occur by chance and consist primarily of cancer and genetic effects. Stochastic effects often show up years after exposure. As the dose to an individual increases, the probability that cancer or a genetic effect will occur also increases. Example of stochastic effects are carcinogenesis and teratogenesis. Non-stochastic or deterministic effects are characterized by a threshold dose, below which they do not occur. Examples of non-stochastic effects are cataractogenesis, fibrosis, sterility, and nonspecific lifespan shortening. To summarize what was mentioned previously, we can mainly focus on the following. While stochastic effects often show up years after exposure, deterministic effects will often be evident within hours or days. For stochastic effects, as the dose to an individual increases, the probability that cancer or a genetic effect will occur also increases. Besides, for stochastic effects, there is no threshold dose below which it is relatively certain that an adverse effect cannot occur. In addition, because stochastic effects can occur in individuals that have not been exposed to radiation above background levels, it can never be determined for certain that an occurrence of cancer or genetic damage was due to a specific exposure. It is also important to note that non-stochastic effects are characterized by threshold dose, below which they do not occur. In addition, the magnitude of the effect is directly proportional to the size of the dose. Unlike stochastic effects, deterministic or non-stochastic effects are characterized by threshold dose below which they do not occur. A deterministic effect to be taken into account during interventional procedures is the risk of cataracts. The exposure to ionizing radiation contributes to the opacification of the eye's crystalline lens, causing cataract. The probability that a single dose of radiation of approximately 2 gray will induce the formation of posterior subcapsular cataract is high and is aggravated with time, age, and dose. The threshold for single exposure is considered to be 0.5 gray. The ICRP 2011 recommendation, cumulative exposure 0.5 sievert in the annual dose limit for radiation workers is 20 millisievert per year. The radiation dose response relationship is demonstrated graphically through a certain curve that maps the observed effects of radiation exposure in relation to the dose of radiation received. As the dose escalates, so do most effects. The variables are plotted along the axis of the graph to demonstrate the relationship between the dose received and the biological effects observed. In graph A, line 1 represents a hypothetical linear straight line, non-threshold curve of radiation dose response relationship. Line 2 represents a hypothetical linear straight line, threshold curve of radiation dose response relationship. A certain amount has to be received in order for a response to occur. And line 3 represents a hypothetical nonlinear threshold curve of radiation dose response relationship. And graph B, hypothetical sigmoid S-shaped nonlinear threshold curve of radiation dose response relationship is generally employed in radiation therapy to demonstrate high dose cellular response. It is a well-known fact that fetuses are highly susceptible to ionizing radiation during the first trimester of pregnancy. Therefore, unless a life or death situation is involved, women should not have elective radiologic procedures during the first 3 months of pregnancy. A fetus exposed to ionizing radiation suffers radiation-induced leukemia 5 years following birth. This is considered a somatic, teratogenic, and mutagenic effect. Radiation exposure has been found to increase the likelihood of cancer in many studies of adult human and animal groups. At doses below the occupational dose limit, an increase in cancer incidence has not been proven, but it is presumed to exist even if it is too small to be measured. The question here is whether the embryo fetus is more sensitive to radiation than an adult. While the evidence for increased sensitivity of the embryo or fetus to cancer induction from radiation exposure is inconclusive, it is prudent to assume that there is some increased sensitivity. Scientific advisory groups assume that radiation exposure before birth may be 2 or 3 times more likely to cause cancer over a person's lifetime than the same amount of radiation received as an adult. If this is true, there would be a one radiation induced cancer death in 200 people exposed in utero at the occupational dose limit of 5 rems. Scientific advisory groups have considered this risk to be too high and have thus recommended that the radiation dose to the embryo or fetus be limited to a maximum of zero point 0.5 rem. At that dose, there would be one radiation induced cancer death per 2,000 people. This would be in addition to the 400 cancer deaths from all causes that one would normally expect in a group of 2,000 people. Prior to taking the examination, please reread the module objectives to verify that you have no additional questions to review.